And we will begin. Thank you, everyone. Those of you attending, I see we have 23 attendees. I welcome all of you, students, faculty attending. Thank you for being a part of our diversity in mental health professions panel discussion, inspiring stories and future opportunities. I am going to lead with some questions. And part of the first question will allow the two panelists we currently have, with someone coming later, it will provide them the opportunity to give a brief introduction to everyone. I will monitor the time wisely because we certainly want to have time for Q&A. So I'm going to do my best. It's 4:31, maybe around 5:15, 5:30-ish, making sure we're wrapping up with the questions. And then our attendees can ask some questions. So thank you so much, Dr. Fuentes, Dr. Cloyd. It is so greatly appreciated that you're joining us. And this is a real treat for our students because traditionally a lot of our panel discussions have Stockton only faculty or local community members. So thank you so very much. So I will allow you each to give a brief introduction, and I guess I'll start. Dr. Fuentes, please give your brief introduction. And the first question is, what led you to the field you specifically selected to study?
Okay, so first of all, good evening, everybody from Northern New Jersey. I'm a professor of psychology at Montclair State University, and I'm using a second screen for the first time. I'm not sure how I got through this past year without this second screen. It's amazing. So sometimes I'll be looking over to the right just to look at my notes. But my journey in the field of psychology started at the undergraduate level as I was taking my general education courses at St. Peter's, at the time, St. Peter's College, now St. Peter's University in Jersey City. I started to just take different courses, history, math, psychology, and I gravitated toward courses where I did well and I felt, connected to the material and connected to the faculty. So I came across a professor, Dr. Rita Wolpert, who I actually was looking her up. As I was preparing for today's presentation, I looked her up and she passed away this past May, which is unfortunate. But she was the person who introduced me to the field. She just had a really wonderful style, and this is just for students who are on the call. I think it's important to let folks know what you want, what you're interested in. So I happen to be having a casual conversation with her as a first-year student or second-year student. Told her I was interested in working with children and families. She had heard about a tutor position in a therapeutic after-school program in Hoboken. And I started working there and remained there for a number of years. That was my introduction to the field of psychology. And I've got more to say, but I'm going to stop there and turn over to my colleague.
Thank you so much. Thank you. So Dr. Cloyd, what led you to the field you specifically chose to study?
Oh, gee. That's hard to say. Really, when I was in high school, I had the opportunity to have a psychology teacher. We had a psychology class in high school, and I thought he was the coolest guy ever. It's just like, oh man, I want to be like him. And the next year I graduated and I went to school, and I decided psychology was going to be my major. And I've been in psychology ever since. My bachelor's degree is in psychology. My master's degree is in psychology. My doctorate degree is in psychology. And I guess I was really lucky. I found a good role model and followed him. That's what led me. And then I found out I really, really liked it. It's good.
And I noticed you both mentioned role models, and I think that's so important. So I just want to note briefly to our students, please seek mentorship and advisement, because look at both of you, that helped so much.
Yeah. It helps a lot.
Well, Dr. Fuentes, did your racial or ethnic background influence your choice of profession, given that we're talking about diversity? Has that played a role, racial or ethnic background?
Oh, absolutely. So I oftentimes when I introduce myself and I discuss my sociocultural profile with folks in the audience, I often say I'm a light-skinned Puerto Rican. For those folks who are familiar with folks in Puerto Rico, they make up a number of different racial ethnic groups. I happen to be light-skinned, and that's because of the various races in Puerto Rico. They manifest themselves differently, and the reason I emphasize the skin color is because there's a fair amount of power and privilege that comes with my skin color, and so I'm aware of that. There's a big conversation going on right now in our discipline around colorism and the impact of colorism within the Latinx community, especially in the Puerto Rican community, and how there is this tendency to prefer folks who are lighter skin and to oppress folks who are darker skin. And so just always being mindful of these various aspects of my identity and how they give me power and privilege and how I can use my power and privilege to help others. So being Puerto Rican, I grew up in a traditional bilingual, bicultural household. My parents really introduced me to the Puerto Rican culture and spoke Spanish to me, and I spoke Spanish back to them, and then my siblings spoke English. And so those dynamics certainly contributed to who I am today. It allowed me to work with the Latinx community. While getting my master's, I was introduced to community psychology and developed a deep appreciation for the systemic forces that shape our identity and our functioning, and how those forces can either facilitate our well-being or impede our well-being. And so that led me to continue my interest in this field. I tend to take a strengths-based approach when I think about my race and ethnicity, and especially when I work with folks from various racial and ethnic backgrounds, because we oftentimes focus on what's not working with communities of color, and there are lots of communities of color that are doing well and thriving. And so I like to sometimes ask, what are those factors that facilitated that wellness and that promotion in these communities of color? Because so much of what's being examined out there, and that's not to say we shouldn't be examining challenges and concerns and deficiencies and disparities, but we should also be looking at folks in communities of color who are doing well, and what are those protective factors that exist so that we can cultivate them and maintain them. Again, I mentioned skin color as something that I find to be important and relevant here in terms of my racial and ethnic background, and just because of who I am, right? So for the longest, if you listen to my first name, right, Knowlton, it's hard to kind of figure out who am I and where am I from and what's my racial and ethnic background. But as soon as people hear Fuentes, I start to come out a little bit more around my racial and ethnic identity, and as a result of that, folks will gravitate toward me. There's a great book by Beverly Tatum titled "Why Do All the Black Kids Sit Together in the Cafeteria?" And it's a very similar phenomenon when it comes to me being Fuentes, right? A lot of Latinx students gravitate toward me. They assume that I can identify with them, they can identify with me, that we've had similar backgrounds, similar challenges, which may or may not be true, but that has led to students gravitating toward me, Latinx students gravitating toward me, so I would advise them, mentor them. That led to me developing a multicultural psychology scholars club at Montclair State University. Every university has a psych club, but I decided to give it a slight twist and develop a multicultural psych club, and so a lot of Latinx students and students of color tend to gravitate toward me. It informs my research, it informs the courses I teach, so my racial and ethnic background has played a key role in who I am today as a mental health professional.
Thank you so much, and I love the strength-based approach. That's very powerful, and it is refreshing to hear. That was great. Thank you. So, Dr. Cloyd, did your racial ethnic background influence your choice of profession?
I think my race has influenced everything I've done in a funny kind of way. I guess when I was in third grade, I integrated the school and my community. The cameras were there. The parents were calling me names. The kids were spitting on me. And that was my earliest experience with coming to grips with my racial identity. We were in a small town on the line of Tennessee and Virginia. And my mother was a teacher. And the superintendent of the schools asked that she send me to the school so it could be integrated. Not long after that, we moved to Philadelphia because the FBI came to our home and told my mother that they were going to kill all of us. And we had to move to Philadelphia. After moving to Philadelphia, I was confronted with another thing. I'd never seen so many African-American people in all my life. I grew up in a small southern town, and I realized that there was a lot of going on, like gangs and all of this, that, and the other. Anyway, to make a long story short, all my life, race has been a part of who I am. I'll never forget who I am. In fact, while I was working on my doctorate, on 2 or 3 separate occasions, the security guards rushed into the class to ask me who I was and did I have ID. And the chairman of the department was sitting right there. So I think race has always been a part of who I am and what I do. And I've had the pleasure of working with some great people who have motivated me and pushed me forward, like Dr. White. I've always had great mentors, and race has influenced me tremendously because when you look around, you see that there are less than 4% of psychologists in the country are African American, and that needs, we have a lot of mental health problems, a lot of trauma in our community. So in order to address those needs, I feel like I have a responsibility to do that. I have to be there. I have to participate. So that's part of the reason. And it has influenced me in many positive and negative ways. Sorry. Is that more than you were asking for?
You both answered it so beautifully. So with such great articulation, and I think both of you just made some very powerful statements. I am very pleased to say, if I may do a shout out, we've got 42 attendees. This is a very well attended event. So thank you, everyone. And I hope we have students and faculty attending, but I certainly hope our students especially are really inspired. You both just shared many powerful things and some very sensitive emotional things as well that you may have been through. So thank you. That's exactly what we want to hear for our
Dr. Carter,
Yes, sir.
did your past situations in that small southern town, did that influence you to go into psychology instead of, say, accounting or business or?
Well,
like
yes, I think it did. As a kid, I think after that experience, fortunately, I was fairly bright and did well in school academically, but I had a heck of a temper. I was angry and mad, and finally my family took me to a psychiatrist and tried to figure out what the problem was and stuff like that. But no one ever really figured it out until I got older, and I recognized that, trauma from the things I experienced led me to be the type of person I am. The anger, the bitterness, the quick temper, all of that stuff. And I really wanted to know. In fact, I did my dissertation on aggression. But that's because my early childhood was, I don't know, marked up by it. And people were trying to figure out what was wrong with me. It wasn't anything wrong with me. It was what had happened to me. as I grew up. And it led me to have empathy for other people who are struggling to figure out what's going on the inside. As a matter of fact, one of my favorite jobs was being the director of the mental health unit at the Philadelphia Youth Study Center, which is a secure detention center for adolescents. And I really enjoyed that because I could recognize that they had trauma and they had a deep need to be treated. And they weren't just conduct disorder, behavioral disorder kids. They were kids who had been hurt and traumatized. So yeah, it did because I always had an interest in wondering why people do the things they do. And I sought it out and I tried to figure it out. And it's been very, I guess I've been very successful at it. I have 2 private practices, clinical director at a major community mental health agency. And I still get to do what I like to do, help people.
Great question. Anyone else want to chime in from our Stockton committee? And we did have someone. Emma Rose. The Q&A. Let's see. Can you chime in? Because we've got our Q&A for after. We do have some questions. Emma, I think you do have to type in your question.
I see it here. Would you like me to go ahead and ask the 2 questions I have now?
Sure, because that looking at the time, that would be perfect. Go right ahead.
So there is a student, I've got 2 questions. The first is, do you know any art therapists in your area? Are people doing art therapy within those communities?
My community, yes.
Is it a growing field? Is it kind of new in terms of art therapy, or has it been around for a while?
Well, I'm inspired to become an art therapist because I love psychology, but I've noticed I also like art too, and I found that art was really relaxing. So I thought, why not become an art therapist and kind of let people see, like by drawing their own images to express how they feel. It's a new way of psychology instead of forcing it. It's something new to everyone, so I thought I'd at least bring that up.
Emma, thank you for the question and the comment. I think I don't know much about art therapy. I know that it's a modality that's used by some mental health professionals to certainly do exactly what you're saying, which is to get folks to communicate. I do think that psychology has failed communities of color, and I think thinking about creative ways to engage folks and get folks to resolve their challenges is important. And so if art therapy is one avenue for that, why not? I mean, the one thing I want to encourage you to do is just make sure that, you apply the scientific method and spend some time understanding its impact and gathering data and making sure that what you are doing is effective with the communities you want to serve.
Oh, thank you so much to you both and to Emma for the question. It's a really good question. We also have one more from another student, and the question is, as an African-American student going into the field of therapy, how would you go about detaching stigma and providing the best quality of care within our Black and Brown communities?
Well, some of the stigma is diminishing. I work at a mid-sized community mental health center in Philadelphia. I'd say 87% of the clientele are African American or people of color. And quite frankly, people of color are becoming more accepting of mental health. And the stigma of mental health is diminishing as more people come out and profess their mental health difficulties of being border bipolar or having anxiety disorders or things like that. It's becoming more and more acceptable. I think at the Community Mental Health Center where I work, we have about 1,400 outpatient adults who receive services. And like I said, 87 to 90% of them are African American. I think the best way to reduce stigma is to talk with people about it and just let them know that it's okay. And that's what we do. And, you know, oftentimes in communities, people are starting to recognize that mental health is an important element in helping them survive and get better. So just talking to them about it. The stigma is going away. You know, you often, I can't get African Americans to stop coming to my offices. I really can't, because they recognize now they have health insurance and they have a need, and they're exercising their right to get it. So I don't think you have to worry too much about the stigma. I think it's something in time that will diminish even further, right? Just be a good role model. Just be out there. Let them know that you do treat people who have mental health difficulties, and they'll be more than happy to come talk to you, right?
Thank you, Dr.
I think good leadership, which Dr. Cloyd does. I've been to his facility and I've met the people with whom he works, and they're all very welcoming, empathic people. And I think a lot of that is a result of Dr. Carter's role modeling and his, what he is leading for them. So.
Thank you, John. I appreciate that.
And Dr. Fuentes, your thoughts.
Yeah. So first of all, Dr. Cloyd, thank you for mentioning Dr. Joseph White. For those folks who are not familiar with Dr. White, he has been deemed the father of Black psychology. We lost him about a year ago, but he has had an amazing impact on the field of psychology, especially on the field of Black psychology. And he has supported so many individuals over the years. And so thank you for mentioning him and for celebrating his legacy. In terms of working with communities of color, I think it's important to not pathologize what they're bringing into the office to see us, right? So if we take a holistic perspective and we see their reactions to discrimination and their reactions to racism and their reactions to oppression as an adaptive response. So rather than pathologizing their behavior, I think if we can normalize it and say that it's a healthy way of responding to challenges. Nancy Boyd Franklin at Rutgers, who wrote the book Black Families in Therapy, oftentimes references healthy cultural suspicion, which is a nice way of framing people's unwillingness to connect with systems that have been oppressive, systems that have been hurtful. And so I can understand why people might want to stay away from mental health systems, because traditional healthcare systems have been problematic. There's been bias in the systems. There's been a tendency to provide subpar care. And so I think understanding how people see us, how they frame us, how they connect with us, how we frame their challenges and their concerns is part of the destigmatizing process.
If I could chime in with that, I can recall studying for my psychology licensing exam, which many of our students out there may do one day, as a licensed professional counselor, licensed clinical psychologist, social worker. I remember so well having to study so much about cultural influences. I very much remember the concept of machismo, and trying to understand that perhaps many Latino Hispanic men may possibly, resist mental health services. So I'm glad we're evolving. Thank you both of you, because I remember studying that many, many years ago. And hopefully, like you both said, we can all move forward. That is great.
Thank you so much. They're really excellent answers. We have a couple of other questions. I wanted to follow up. Do you see on understanding stigma in mental health, are there big disparities in socioeconomic status and people reaching out or having the knowledge and the avenues to reach out for mental health help?
Actually, there is a lot of disparity between persons of color and the normal population or Caucasian Americans. There's a lot of disparity in healthcare, medical healthcare, and psychological healthcare. In fact, African Americans or people of color traditionally, say if you have depression, 73% of the people who are Caucasian receive a treatment for depression, but only 50% of African Americans who have depression receive treatment. If you talk about people having access to medical care, African Americans traditionally, like Dr. Fuentes said, have been skeptical of accepting help from the medical practice since, particularly since the syphilis experiment on African American men. So trust in physicians or psychologists or doctors has not been something that our community has traditionally done. So there's a lot of disparity. There's a disparity in prison. There's a disparity. There's 13% of the African American population is the population. There's a 13% of population of Latino or Hispanic. And we wind up being about 64% of the population in prison. And you quite naturally, when you're in prison, rarely do you get mental health treatment. So that means a lot of the people who are in prison who have bipolar disorder, schizophrenia, or some other major mental health difficulty, they don't get the treatment. So there's a wide disparity between people who have access to mental health difficulty and people of color or people of different ethnic backgrounds. I probably have some more facts and figures at my fingertips, but that just goes to say that more people need to be in mental health, providing mental health. In fact, African Americans and people of color traditionally have less utilization of outpatient programs and more utilization of inpatient programs. But the problem with the inpatient programs is when they go into the inpatient hospitalizations, they traditionally don't stay as long as their counterparts do because they don't get along too well with the way doctors talk to them. In general, the research has indicated that Caucasian doctors talk to African American clients in a more directive way, in a less collaborative way, and generally causes more conflict. So the African American population feels like, hey, you can't communicate with me. You don't understand me. So they get up and leave out of the hospital. So there's ample reason why we should increase our numbers in providing mental health services or any other services to African American populations or people of color or people of different ethnic groups, because we want to be, how do you say it? We want to be able to communicate effectively. We want to be able to show that we understand what your problem is and we can communicate it effectively. Traditionally, African Americans have been seen as being very aggressive and hostile. But now we know that traditionally African Americans who are aggressive and hostile have a tendency to be aggressive and hostile, not because they're angry, but because they're depressed. So they need treatment for depression. So understanding your culture and understanding the people who come to you for treatment is an important thing to do. don't get me started. I just had my second cup of tea, so I'm starting to work here. And the person I was kind of looking up to, Dr. Fuentes, was John White, Dr. White. He's been a mentor to me as well, and has spurred me on quite a bit. Okay. Thank you. Sorry.
Thank you for the clarification.
Okay.
What I appreciate about your first of all, thank you for those comments. And what I appreciate about the question is the idea of intersectionality, right? So thinking about communities of color as they intersect with class, for example. Although there is an overrepresentation of particular communities of color in particular class brackets, so we can be mindful of that. But also thinking through intersectionality in terms of race, ethnicity, age, sexual orientation, disability. So, if you look at the multicultural guidelines that APA put out just recently, there's a strong emphasis around intersectionality, not thinking about our identities in siloed ways, but thinking about the way the aspects of our identity intersect to inform who we are and our functioning.
Absolutely. As a matter of fact, I was just looking at some of the stuff on gender identity, race identity, and mental health. And the fact remains that African American men and men of color and men whose identity is male or female or uncertain are more likely to be victimized in their communities, are more likely to have more problems mental health wise and need more support than they traditionally would get. So we can expect a higher percentage of African American and sexual minorities to need mental health counseling, but not necessarily feel like they can get it because traditional psychologists or psychiatrists or mental health professionals haven't always felt comfortable providing them with service in a way that they could receive it. Very true. Very true. I like
Thank
you,
you.
Dr. Fuentes.
Thank
All
you
right.
both so much for your responses. I really, the information is jaw-dropping and really underscores the need, the tremendous need for people, Black and Brown people, to become mental health professionals, to engage with experiences and be able to relate with their patients and clients. I've got a lot of great questions coming in. Is that okay, Dr. Kate? Okay. So I have here, so how do you help somebody dealing with generational trauma, particularly in the African American culture, that are affected by systemic oppression and witnessing police brutality and social media that carry the burdens of their ancestors to this day?
Oh, wow. That's a
I know.
heavy question. Fortunately for me, I think, first of all, the most important thing is to get good, solid trauma training. If you're going to help people, get training. The Community Mental Health Center where I'm located, we're an evidence-based trauma treatment program. So we got training through Dr. Edna Foa and prolonged exposure. And I think first step is to get excellent training. Once you get excellent training, then you have to provide integrative services to people. And what that means is help them get a healthy diet. Help them get attention for medical problems that might be related to transgenerational trauma. Help them with that. Help them with their education. So you have to integrate your services in order to resolve their difficulty. I think that's the best thing. Good health, good education, good exercise. So, and prolonged exposure, particularly is effective in helping people who have more acute trauma and complex trauma. And you also have to talk to them about bereavement and complicated bereavement so that you can support them. So I think that there are a number of things that can be done. And I think one of the things that one of my frat brothers told me, Dr. Lightfoot, who's a psychiatrist who is one of the authors in this book that I was just holding on to, said that what we need to do is reduce the level of stimulation that we're taking in as this racial injustice and political unrest goes on. So if you want to talk to African American people, talk to them and say, hey, look, limit the amount of time that you're listening to the crazy stuff on TV. Limit that. And if you're going to get some information, get it from a quality source that doesn't exaggerate it, but gives you the facts, and then turn it off. Then engage in some healthy exercises, engage in your spiritual life, try to develop that, try to develop other wellness strategies that will help you to contend with that, improve your diet, all of those things. Go to therapy, get treatment for it. So there are a number of things to do. So you just have to have an integrated approach, good medical care, good education, good spiritual life, good therapy, and start working at it, okay? That's a quick and dirty look at it, but that's what you have to do. And try to help them find some reasonable economic source. How can they get some training so that they can move themselves up out of hostile, negative environments and make a better go of it. So that's what I think. I don't know. I hope that.
Thank you, Dr. Cloyd.
I hope that answers.
Yeah, first of all, I just want to recognize whoever asked that question. What a wonderful question, and quite complex, quite nuanced. And Dr. Cloyd gave a great response for how to deal with things at a more micro level. And I'm going to just ask folks to zoom out for a second and think about the macro forces. So what can we as mental health professionals do to address macro forces, right? Because I like to think about it in terms of the river parable, right? I'm not sure if folks are familiar with that parable, but imagine if we're all hanging out by a river and we start to see people floating down the river drowning. And we jump in and we grab somebody and we bring them ashore and we make sure they're safe. And then we see more people coming down the river and they're drowning and we keep leaping in. Well, somebody's got to run upstream. Somebody's got to find out who's throwing the people into the river. And so I want to encourage folks as you consider your mental health careers, pick a career that will allow you to engage in social justice, that will allow you to engage in advocacy. Look for programs that introduce you to non-traditional ways of thinking, more like feminist paradigms or liberation psychology, because those are the paradigms that will encourage us to empower our communities, to take a deep look at ourselves, who we are, and how we might relate to folks and how our relations might impact folks, and also how we might engage in advocacy to address those macro forces. So we have to be constantly zooming in and zooming out if we really want to be truly helpful to all folks and communities of color in particular.
So become political. Right?
Thank you.
Thank you. Before we go to more Q&A, we have the honor of another panelist. Thank you so much for joining us today. Dr. Prem, I will let you introduce yourself. I am truly not sure if I said your last name correctly.
Yes, my name is Dr. Barbara Prempeh. I actually just finished up with the parent group, so sorry for being late. But I'm glad that I came in at such a great time to an awesome Q&A. So I went to, just to quickly tell a little bit about myself, I went to Howard University for my bachelor's in psychology, then went to John Jay College of Criminal Justice for my master's in forensic psychology, and then went to Kean University for my doctorate in clinical and school psychology. My passion and I would say my specialization is in trauma and juvenile justice. So for my doctorate internship, I was at a juvenile detention center and really got to see firsthand the statistic that currently 92% of children in the juvenile justice system have a history of trauma and victimization. So from that, my perspective changed from, just wanting to be in the juvenile justice system, working with kids in the juvenile justice system, to learning more about trauma in order to better help children that have been involved in the justice system. So since graduating, I've been working at the Winona's House Child Advocacy Center, doing assessment and evaluation for children that have been abused in Essex County. And so I work with the prosecutor's office, special victims unit, division, child protection services, and things of that nature regarding those evaluations and treatment. And I also train doctorate students in doing the same work. I also am a adjunct professor at Montclair State, and then also at Kane University. And, sorry, my office phone. And then I've had the fortunate honor of doing police community trauma trainings through a nonprofit organization called Equal Justice USA, to help really bring the community and police officers together to talk about trauma, individual trauma, community, collective trauma, and of course, acknowledging vicarious trauma of officers, to really take them from a place of trauma to a place of trust and healing, and providing trauma-informed practices for policing. So that's all that I do.
Thank you. And to all our students out there, real quick, before we get to more Q&A, I thank you so much. Thank you for joining us. I responded like this to Edna Foa. Please, all of you out there, my students who want to work, all of our students who want to work with trauma, I had the honor of being trained by Edna Foa in Philadelphia. What an honor. Edna Foa, F-O-A, please read her research. So thank you all. So I'll let you take over Q&A.
Thank you so much, Dr. Prempeh, for joining us as well. I am going to move on to the next question here. And this is more about graduate school and obtaining the graduate degree. So this person asks, or the student is asking, what are some important questions one should ask themselves when trying to narrow down what specifically they want to offer with their psychology degree? And what are some concrete steps you've experienced in shaping your career path and getting that degree? And I can open it up to whomever would like to take that.
I guess I'll go ahead, Dr. Prempeh.
I was just going to ask to repeat the first half of the question.
Absolutely. So it is a two-parter here. Let me find it. Okay. So what are some important questions one should ask themselves when trying to narrow down what they specifically want to do? And I think in terms of, is it a master's in mental health counseling or a PsyD or clinical psych? How do you make that decision on what the type of degree that you want in mental health, like in psychology? And then
So I get that question. Yeah. Why don't we start with that first part real quick? I get that quite, by the way, Dr. Prempeh, nice to meet you. I'm glad you're with us, and I'm glad that we share this MSU connection.
Yeah.
Hopefully when all this is over, we can meet on campus.
Yes, yes.
So I teach an undergraduate course in systems of psychotherapy, and I get that question a lot. What's the difference between, mental health counseling, social work, clinical psychology, counseling psychology, marriage and family therapy? And it's a complicated question. I really encourage students to check out the professional associations for each of these disciplines. So, check out the National Association of Social Work, check out the American Counseling Association, check out the American Psych Association. Learn who they are, what are their values, what do they emphasize. Check out the programs and the kinds of courses that they're going to ask you to take, because you're going to be spending 2 or 3, 4 or 5 years doing these things. Crudely speaking, in terms of within psychology, if you want to be a licensed psychologist, you can pursue either a PhD, PsyD, in some cases an EDD in either clinical psychology, counseling psychology, or school psychology at the doctoral level. And so thinking through those various fields, what do they emphasize? Why would you get a PhD versus a PsyD? You know, crudely speaking, PhDs typically prepare people for careers in academia, research, and teaching, and PsyDs typically prepare folks to practice, but that's not always the case. I have a PsyD from Rutgers University, and I'm a full professor at Montclair State, and I've been doing research and teaching for the past 20 years. So there's exceptions to the rule, but just trying to narrow down your decision in doing that background research to understand what's the difference in these fields and what kind of coursework do they offer, and so on and so forth. So I'll stop there and let my colleagues chime in.
I guess my advice would be find something you like, and then you can find some area of psychology that you can apply to it, something that you're interested in, and you can find an area of psychology that is applicable. I think psychology is one of those broad fields where you can do practice, research in almost any life experience that you want to think about in any area. It could be trauma, it could be geriatrics, it could be a whole host of things. So if you find something you like, check and see if there's something you like in psychology, because it's 9 times out of 10 it's there. So that's my advice.
I would like to add that, I think definitely researching what you want to do in the long run, right? And having the flexibility to understand that there's different paths to get there. So I would say for myself, once I finish undergrad, but just backtrack, in undergrad, right, I engaged in this program called the McNair program, which helps prepare minority students and first generation college students for a doctorate degree, in that it allows you to do research in undergrad. And through that, I thought, okay, I'm definitely going to get into a doctorate program right away because I did that. It was great. It helped me. But then I didn't get into a doctorate program the first time I applied, and I really, of course, was hurt and upset by that. And I had to realize that the path may not be as straight as everyone else's, right? Being able to go right after undergrad. And I had to be flexible in considering, well, I may have to get my master's first to make me a more competitive applicant to be able to get into a doctorate program. So that's when I did the master's program at John Jay. And I knew that it wasn't necessarily where I would have wanted to stop, that I was going to go on for something else. And that's why I picked the specific master's in forensic psychology, just to be able to have that specialization. And then I applied for a doctorate program after. So while I was also in my master's program, I made sure to connect with a faculty to do research with them. So it's very helpful that when you are in your programs, or even when you've graduated and you've been out and you want to go on for a doctorate, find a faculty at a university that you could potentially assist them in any research that they're doing. And sometimes you may send a cold email, if you research someone and you see that they're nearby and they're doing research in something that you're interested in, you can send an email to say, hey, I'm just looking for an opportunity to volunteer and support someone's research, so that you can get that experience to show your commitment in research for a doctorate program. And then also possibly volunteering at certain centers to get clinical training hours. And this shows that you're continuously committed to the field that makes certain doctorate programs look at you more favorably. And then with my end goal of knowing that I really wanted to work with children and adolescents primarily, and now work with all spectrums, but that's why I was flexible in getting a degree, not necessarily like a PhD in clinical psychology, but I was open to a PsyD, and open to a degree in school psych and clinical psych, knowing that ultimately I can still get licensed and practice as a psychologist. So that flexibility helps because there are some programs that are very prestigious that they get about 500 applicants and they're only going to accept 8 people. That's very competitive. I'm not saying that you're not going to be one of the 8. However, just acknowledging the chances in that and being flexible to go multiple ways. So like I know someone who went to Rutgers, got their PsyD in school psychology, and she's worked at, a prison. She works at a counseling center and not necessarily working in a school setting because of the internship and externship experiences she's had and connections she's made after. So I think, having your end goal in mind and being flexible to understand that the path may not be as straightforward and direct, but there's other ways that you can still get to that end goal is important, because sometimes if we limit ourselves that it has to be just a PhD or it has to be just a certain degree, there's so much flexibility within our degrees in psychology that you can tweak it however you want. My degree is as a PsyD. However, my program allowed us to do so many research opportunities that I engaged in that, I would say that my CV is comparable to someone that had a PhD. And I got asked that a lot, like, are you sure you want to do this clinical stuff? Because you did a lot of research and presentation. So I put myself out there to also gain other opportunities.
Thank you so much. That is excellent advice from all of you. And I think it's important. I want to kind of underscore being active, in your field and looking and trying to create opportunities for yourself by cold emailing, now, or, finding people that do research that you want to, that you'd like to do, that you're interested in. Thank you very much. We have from one of our faculty members before Dr. Prempe came on, she's thanking Dr. Cloyd and Dr. Fuentes to appreciate your honesty in sharing your experiences with racial trauma and your reflection on privilege and power in systems and how that relates to your practice of psychology. Thank you for that. And I'm going to pop around a little bit here in terms of some of the questions. We have great questions coming in. One is from actually Emma, and she's asking, what are good quality traits in a female leader, and how does gender affect society and its impact on mental health in terms of access as well?
These are such complex and nuanced questions. I mean, gender is, an aspect of identity, as we talked about earlier, that definitely informs, who we are and our functioning. There are certainly biases in society that that can compromise the well-being of women or women or people who identify as women in society. So definitely want to be mindful of that. As a matter of fact, there's good research that has found that because of people's gender identities, they get socialized into certain fields, or they get their talents get dismissed or not recognized. So just being aware of the implicit biases that exist against women and thinking about ways to protect yourself against those. Great question about women in leadership. I know that APA has a great program for women who are interested in being leaders. So if that's something of interest to you, please type in your web browser, Women Psychology Leadership, and you might get introduced to that program.
So I would say, generally speaking, the field of psychology is primarily dominated by women, but it's still good to acknowledge some of the barriers that we still may face. So I think being sure to advocate for yourself in situations and recognizing the needs of, certain inequalities that may be occurring for yourself, your patients, and the greater populations that are served is very important. And really, I think the climb to the leadership role, that it's still there. There's still these biases in it, and that just being committed to your goal of getting into leadership and doing things that'll help make you be a better prospective applicant per se for that leadership role. And I think that's a great resource, you provided, Milton, in regards to like a leadership program or just finding ways, again, within certain settings that you can initiate that responsibility to say, hey, can I take the lead on this? Or, can I put this together and things of that nature to kind of build up your skill. And sometimes building up that skill without having the title still can benefit for when you do apply for a position with that title in it. So, recognizing that there are still barriers in place, even though it's a female dominated field, and addressing them when they arise.
Thank you so much. Dr. Cloyd, did you want to jump in, or is that in terms of gender and mental health, or is it
Well,
kind of the same?
I don't really have an answer for that. I think that the best thing to do, if you're thinking about women in leadership roles and learning about leadership, is the same for just about everybody else. Become an effective communicator. Work on your communication skills. And if you work on your communication skills, that will be step one in becoming an effective leader. And I think that's important. I really don't want to venture too far off the beaten path because that's not really my area. So
That's great advice. The communication really is key in so many different areas, and especially when we're trying to make known what we need and where we want to go in those. Thank you all. All right, some more great questions here. Our students are just fantastic. One of the questions the students asking is, how do children of parents who don't believe in mental health break the negative stigma, and especially when most of these children are discouraged to seek help? And I think this is both children and as, adolescents and as college students as well, if you're from a family that doesn't believe in mental health issues.
So I don't know if folks are familiar with the framework motivational interviewing. It's a great framework that's been around since the 70s. It was born in the substance abuse field. There's over 1,000 clinical studies that have found that it's very effective. And its main goal is to help people resolve ambivalence around behavioral change. So if somebody needs mental health services and they are reluctant or they've got mixed feelings about it, motivational interviewing might be helpful. It might be a helpful approach to help individuals resolve their ambivalence. But there's nothing really magical about motivational interviewing. When we drill down to understand what exactly is going on, we get people to clarify their values, what's important, and we get people to clarify their goals. And so when I work with Latinx families, I don't start with, why did you hit your child? That's not very helpful. Don't you care about your child? I ask them to share what are their dreams for their children, what are their goals for their children. In my 20 plus years of working with parents, I've never met a parent who has said to me, I want to mess my kids up as much as possible. That's just never happened. When I say to parents, tell me what you want for your kids, they're usually amazing goals, amazing dreams, and we work from there. So let's think about ways to make that happen. What might be some first steps to make that happen? And whenever we're trying to get anybody to resolve ambivalence about any behavioral change, I usually recommend motivational interviewing.
I think I agree with the motivational interview, and I think that's an excellent step. What I've found is children are usually introduced to the concept of mental health at school. And if they make a good connection with their school counselor in the school, that can often be the first step to helping to destigmatize mental health in a family. What we found is that counseling in the schools can be more effective than counseling outside of the schools because it's a more flexible environment where colleagues or other kids, their cohorts, can also help them address similar issues in counseling groups and in individual sessions. So I always say, start with the school. Let them introduce themselves to the school and the school counselor. And then usually from that experience, they can transition to a more outpatient setting or therapist or psychologist or whatever they need to do. But I usually say that, they have a good relationship with the teachers at school, and then it transitions to the counselor, and then it transitions up and out of the school when the problem becomes even more acute or more difficult. So that's usually my take on it. And usually you'll find that particularly adolescents and children who have trauma sometimes actually do better when their trauma is treated in school with other kids who have been similarly affected by it. So I would say school counseling is probably the first step.
Yeah, I think this is a question that really helps us to recognize, individual beliefs, cultural beliefs, right, that can play into people's reluctance to engage in therapy. And what are the stigmas within certain ethnicities and cultures that are behind engaging in therapy, and what does that mean? So I definitely love the what's been said before in regards to motivational interviewing and seeing what the parent's goal is and having that be the guiding force behind how to get them more open to therapy. And then also therapy in non-traditional settings. Well, now it's more traditional being in the school setting, but I think that's key, right? Thinking outside of the box of traditional come into the office and sitting on a couch type of therapy. It doesn't necessarily happen like that. And some people, they may not be comfortable like that. I know my experience, especially in the juvenile detention center, where some kids, we had to do therapy while walking around on a basketball court inside the detention center. Like that was more relatable than us just sitting down. So I think really having, I'm glad for us utilizing teletherapy now, because sometimes there's stigma not necessarily in the individual going, but what if somebody sees me going into that counseling center or that place that everybody knows is for therapy, right? And so now with teletherapy, where things can be done in the privacy of your home, that's very convenient. And then maybe there are other barriers to it, not necessarily that I don't want my kid in therapy, but my schedule is packed and I just don't have the time to take my kid to therapy, or I don't have the resources, right, financially, or it takes about 2 or 3 buses to be able to get to wherever this therapy is. So I think really understanding the underlying basis of it and acknowledging that sometimes there are like cultural barriers where that's just, some parents may feel like it's not, oh, my kid is not crazy, or the problem is not that bad, right? Thinking that sometimes therapy is very proactive and preventative as well and can help to not make things get worse. But some parents may feel like, oh, it's not that bad yet, so we're fine. So I think really just trying to find non-traditional ways of having the child engage in therapy, and just as the clinician, the person or the provider that feels like this family would benefit, engaging with that family in non-traditional ways to have them be open to you, the person or the clinician first, right? Saying, okay, well, I can have 15 minutes for Q&A, right? It's not a therapy session. It's just a Q&A. Whatever questions you have, we can talk about it, making it informal so they feel like, okay, you're relatable. I can talk to you. So I think we really have to be open-minded as to the reasons why the individual or the parent is reluctant to have their kid engage in therapy. And sometimes it may not be as straightforward as, oh, the parent just doesn't care, or they're not committed to their child well-being. They may not have the resources or capacity, and you may have to troubleshoot for them to get those resources and that capacity first to be able to provide that therapy.
Thank you all so much. Those are excellent responses and really very thoughtful. Thank you. I've got just a couple of more questions before I'll turn it over to Christine again. There is one here in terms of kind of a specific question that I'll just throw out to whoever would like to take it in terms of degrees. And so this student is asking if I pursue a Master's of Social Work degree with a mental health specialization, would it allow me to be just as hands-on in the mental health field as a Master's in Counseling or a Master's in Psychology degree? And I'm not sure if somebody...
I can sort of answer it. I work a lot. When you get a master's degree in social work with an emphasis on clinical service, you very well are equipped to talk to people on a one-to-one level, or to provide therapy or counseling. At the Community Mental Health Center where I work, there are LCSWs and LSWs who provide clinical service. So with a master's degree in mental health, you can provide direct service. As a matter of fact, you can be an administrator. So sometimes it's not all about the degree, but the degree is important, and you can provide service. If you want to be involved in community mental health, you're certainly welcome. And now they are licensing master's level people in mental health. Education is important. You can probably do more things the further you go in your education, but certainly having a master's degree equips you to do mental health and to help treat people, right? It does. At LCSW, people are looking for them all the time, right? That's a licensed clinical social worker, right?
Thank you.
Just want to clarify from the student's question. So the at the master's level, with a degree in psychology, you're not license eligible, right? So if you can pursue licensure as a social worker, you can pursue licensure as a marriage and family therapist, and you can pursue licensure as a professional counselor. Those are all master level degrees, about 60 plus credits, about 2 to 3 years to complete the degrees. But in psychology, if you're interested in becoming a licensed psychologist, you do have to pursue a doctorate. I may be saying something very different in 3 years, because right now the Council of Representatives for the American Psych Association has authorized a body to look at licensing master level psychologists, but that's not the case just yet. But if you ask yourself, so if I can deliver direct services as a social worker, as a counselor, as a marriage and family therapist, a psychologist, then what's the difference? In my mind, psychologists go to school for 5 years. We use the science to inform our practice. We are the only mental health professionals who are able to do formal psychological assessment. And in my mind, at the end of our experience, I consider us to be master clinicians because we've trained for 5 years. We've got 3 years of practicum, 1 full year of internship. We've got the foundational coursework. So in my mind, at the end of the day, we are master clinicians. The master level folks get their degree in 2 or 3 years, and then they need to get additional clinical hours to become licensed. So a social worker first becomes a licensed social worker and then accumulates their hours and then becomes a licensed clinical social worker. So that's more training under supervision of somebody. And so just, there are differences, but at the end of the day, as Dr. Cloyd mentioned, a lot of these degrees lead to the path of licensure.
Thank you both so much. That's very informative for our students. I have one question here from a student, and they're asking, what resources can we offer to the Black transgender community, especially in lieu of recent events in America? And kind of thinking maybe more specifically like mental health resources, but are there others out there that cater specifically to that segment of society?
The first thing I'd say is recognizing that it is one of the most vulnerable group of people. First, because of sexual identity. Second, because of your race or ethnic identity. Makes you very vulnerable to violence, aggression, negative stereotyping, abuse, misuse. And generally have a higher level of medical difficulties and mental health difficulties. I think if you can find a good community where people support you and you have a good sense of who your friends are and who your helpers are, I think try to do that. Try to take, the support from your community. Try to have a spiritual life. Try to find some way of practicing your spirituality, and try also to become involved in some therapy when you need it, and don't take no for an answer. Go if you feel like you need help. I know that in Philadelphia they have a few programs that address specific gender identity difficulties or questions or problems, like the Moscone Clinic or the Addict or some of these other programs. But truthfully, I think you should be able to go to any therapist or psychologist and sit down and talk about what your issue is and what your problem is, and be welcomed. And I think that that's an important thing to do. Okay. I don't know if that really answers your question, but it I hope you understand that I understand that it is a very vulnerable population that has been aggressed against tremendously. And trauma is probably one of the top issues that you have to face, and getting some treatment for that is available to, from people who are willing to work with everybody, and don't let anybody stop you from getting help or treatment or support, right? And become politically active. So I think that's important. Okay.
Thank you so much. Dr. Fuentes or Dr. Prempe, would you like to add to that? Thank you, Dr. Cloyd. I think it's important to remember there are multiple, what mental health professionals do and provide, and to keep healthy, mentally, but also physically and the community based, and to find people, a supportive network.
Yes, I definitely agree with Dr. Cloyd in the sense that, this is a special population that should be recognized in the support that's needed. And I think it's very key and important to get a part of some type of support group or a therapeutic setting that is, LGBTQ friendly. So I know most of you guys are in South Jersey. I know of a great place here in Northern Jersey called the Hedrick Martin Institute. And, that's the population that they serve, and they have great resources. So I think really searching within the area that you're in centers that specialize in treatment of that population, because you want to be keen to individuals that are trained and have the knowledge of the special needs, and recognize that the trauma is complex, right? So that's very important to identify those places. And I know for me, in my work, is educating others on the trauma, the complex traumas experienced in that population. I utilize resources from the National Child Traumatic Stress Network. They do have some resources specific to the LGBTQ community. So you can look further there to get more resources if it's a child or an adolescent that needs the support.
The only thing I'll add to what my colleagues have shared is that the American Psychological Association maintains an office for sexual and gender diversity, and on their webpage they have a number of resources as well.
Excellent. Thank you guys very much. And now I know we're getting close to our witching time, but we had another question come in, and it's asking, how can mental health professionals and students become more mindful on their own internalized racial and gender biases to keep from alienating the people that they're trying to help heal? And just an excellent question.
This is,
I'm sorry. No, go ahead. After you.
sorry. It's key in every profession, but it's very important as clinicians in doing that internal work before it's projected onto your patient. I teach a multicultural counseling class, and the way I structure my class is we're going to do that internal work in the first portion, and then we're going to learn a lot more about other cultures, because oftentimes, without recognizing your own implicit biases that you have, and how they show up in your day-to-day interactions, can project onto the patients that you serve without even recognizing and realizing it. So now is a great time for those that are participating that are not yet clinicians to start doing that internal work, so that when you get to the point of being a clinician, it's not being projected onto the patients that you serve. So really educate yourself, not just through the books that you read, but going into certain environments to not just read about certain cultures and practices, but immerse yourself in it to really see what it's like, and recognize the biases that you have and start addressing it now. Yeah.
One thing that I've always found helpful is clinical supervision. I have 3 or 4 clinical groups that I participate per week. And I think that participating in clinical supervision clinical group supervision is helpful, as well as individual clinical supervision. I think it's one of the most helpful ways of working through your issues of transference or countertransference when you're working with other people, other groups, and other cultures. And if you're going to work with a different culture, it's often suggested that you get clinical supervision from someone who has worked with that culture before, so that they can help guide you in your growth and development in working through your issues in terms of working with that group. So that's my recommendation. I find that people who work in isolation or by themselves usually find themselves in a little bit of trouble. It's usually better to get some clinical group supervision and individual supervision when you can really get it. And that helps you look at yourself and improve yourself. Okay. And read widely. And broadly, sorry.
No, you set me up. Speaking of reading, I want to highly recommend a book by Banaji and Greenwald, The Blind Spot. They are the leading experts on implicit bias, and I wish they had a more positive message to communicate in that book. You know, I'm 51 years old, which means I've had 51 years of being socialized to think a particular way. And so it's going to take a lot of effort for me to undo all my biases. But it does, in order to undo our biases, first we need to bring awareness to them. And certainly, as Dr. Cloyd mentioned, and as Dr. Prempeh mentioned, we have to spend some time understanding ourselves, unpacking ourselves, talking to somebody else who can be honest with us, with who we are. But in addition to that, there are a number of strategies that can help reduce our implicit biases. And I want to call your attention to, what is her name? I'm blanking on her name right now, but she wrote a great article on reducing racial bias. Gosh, what is her name? She did a study where she introduced people to 5 strategies for reducing implicit bias, and just highly recommend those strategies, because it is going to take time to unpack, to understand our implicit biases and to try to mitigate them or soften them. It is really difficult to get rid of them. I wish I could say we can get rid of our biases, but that's a tall task.
Thank you all. The excellent recommendations, and certainly something that each one of us, deals with when we're working with people. That's it for the questions. It was, I will turn it over to Dr. Gata, but I wanted to thank everyone for, I think, exceeded my expectations in terms of the knowledge and the depth and the breadth of what was covered here. Incredible information and really empowering, not just for me personally, but also for our, the students and how they envision their future within the field of psychology, and really how critical it is in terms of that lack of diversity that we find in mental health professionals as well.
Thank you. Yeah, I think in closing, a tremendous thank you to everyone who attended, our panelists for giving their precious time. Time is tough in a pandemic, so we are so very grateful from everyone at Stockton, and I speak for our students. Thank you to our panelists.